Welcome to my Epidemiology project by me, Amanda Latore. Developmental Hip Dysplasia, otherwise known as DDH. So what is it? It's a medical term used to describe a hip joint that is unstable or loose in infants and babies. It's developmental because instability can occur after birth. Although this is not always the case, a child's hip is otherwise normal except for the instability. Basically, it popped out of the socket. Different types, ranging from normal to high dislocation, has a wide range of severity. In some children, the ligaments around the hip joint are loose, allowing the hip to subluxate. This is when the ball is no longer centered in the socket. Other times, the ball is slightly or completely dislocated from the socket. So there's different levels of severity for this. Learn about it. The last major review of epidemiology of hip disease was in 1977, and when you think about how much technology we've accumulated since then, it's kind of crazy that they haven't done another study on it. And it's called an epidemiologic conundrum. DDH encompasses a wide spectrum of pathology, ranging from a complete fixed dislocation at birth to an asymptomatic acetabular dysplasia in the adult. The epidemiologic literature regarding DDH is vast and confusing due to different definitions of hip dysplasia, different methods of diagnosis, different ages of the population, clinical experience of the examiner, different ethnicities, races, and different geographic locations within similar ethnic populations. It's infants and babies. It's usually there within the first 6 weeks of life. And we'll go into who it's more common for in a little bit. The incidence. The risk factors associated with DDH is females, firstborns, breech positions, and a positive family history. So family history statistics are pretty significant. If a child has DDH, the risk of another child having it is 6% or 1 in 17. If a parent has it, it jumps to 1 in 8. If a parent and the child have it, the risk of a subsequent child having it is 1 in 3. So there's absolutely a genetic part of this disorder. Age varies dramatically. Since 1980, the incidence of DDH ranges from 4.4% to 51.8%, or 4.4 to 51.8 of every 100 births, depending on ethnicity and demographics. U.S., the general incidence for a positive diagnosis of DDH varies from 2 to 9 per 1,000 live births. Higher end, Native Americans. They have one of the highest incidences of DDH due to a combination of genetics and swaddling. Swaddling is the #1 environmental factor in regards to the development of DDH. Their incidence can be as high as 76.1 per 1,000 live births. That's really, really substantial. They swaddle the legs straight and put the babies on a papoose board to transport them, and the position that puts the hips in is really detrimental for the development of healthy hips, and that's one of the reasons why they have such a high incidence of DDH. Africans living in Africa have one of the lowest rates of DDH in the world, less than 1 per 1,000 live births. As you can see, the way the mother is wearing her child with his hips apart in the froggy position, his legs around her body, this is one of the best ways to wear your child. And this is why, in addition to genetics, that they have such a low incidence of DDH. This is the best way to wear your child, whether on your back, on your front, on your hip, keeping their legs apart, up and out, keeping their hips in a healthy position for development. The African people have it down for DDH. This is fantastic. So some other statistics about DDH. 64% of cases affect the left hip, and 63.4% of cases are unilateral, meaning they only affect one side. Let's sum up. About public health education. This is something that as a new mother I was never taught about, and It's not in any of the baby books that you read about. There's little to no public education on this disorder, which is really troubling because it's becoming pretty common, depending on your genetics and your cultural affiliation. But if it goes undiagnosed or untreated in childhood, that child's going to need a hip replacement by the time they're 20. That's pretty, discouraging to think that there's no public health education on this topic. It needs to be improved. Parents need to know to look out for it. If it goes undiagnosed for too long, even just to the age where the child is 6 months old, surgery is almost guaranteed at that point. There are other treatment options. I know we're not really getting into that. They have braces and harnesses that my daughter used, and it can't wait that long. So there really needs to be more public education on this topic. And then just to summarize